you're looking at some numbers here that just talk about calls coming in, missed calls, the revenue impact of those missed calls. You are spending money on marketing dollars to drive that impact. The phone rings, the revenue walks out the door. Okay, great. We've got this picture painted, but you have a marketing background. The customer journey, and in this case, the patient journey, isn't always linear, right? It weaves a winding road from time to time. So talk about a little bit the modern patient journey, their expectations, what happens if those expectations aren't met, what is operationally happening within a business, and not just in in one practice is one thing, but when you scale that across 100 locations, it really starts to tell an interesting story. So your view on the patient journey and how these puzzle pieces fit together would be super insightful.
Yeah. So for us, when I was really looking at like even just the conversations I was having with the doctors, they would say to me, we're getting low quality leads. And without this data, I really couldn't even, defend our department or defend myself. I would say, well, right now, and things have changed. This has been a couple of years ago. I mean, we didn't have an ROI report at that point. We couldn't even see how the number of leads to the number of appointments and the revenue that was generated. This was 2 years ago. Now we can see this, but at the time I was like, all I could go off is this doctor saying the phone's not ringing, which I had no insight into, and these are low quality patients and you're not driving the right patients. So that's where and why I fought so hard for this data and these analytics. So in terms of that journey, right, you've got the new patient coming in, they're calling in, and if they get voicemail, they're immediately going to another practice, right? And so just making sure that there is all of these things in place. We've got just answering the phone first, right? And then, understanding the different reasons that a patient isn't booking. That was our next layer of data that we were receiving. So we were able to kind of separate it out and say, okay, for our new patients, we aren't converting because of schedule. They can't get in. That was a whole other box that opened up where it was like we didn't have a line of sight into where our practices were in terms of what we call their third next available appointment. And so as we saw Peerlogic data showing that 38% of our new patients that didn't convert were because of a schedule, this opened up just huge
Interesting.
projects around our scheduling and ensuring that we are getting new patients in within 7 days. And so just when you talk about that patient journey, it's just like making sure that there's access to care.